right, we are here with Cassie Wilder. She is a naturopathic doctor. She's the owner of Minneapolis Integrative Medical Center, and she's gonna help us learn about some like postpartum things. So tell us more about you, Cassie.
Yeah. I went to and received my doctorate in naturopathic medicine in Tempe, Arizona, and then decided to follow my husband, who's native Minnesotan, back to the Midwest and started, Minneapolis Integrative Medicine Center in 2017. And really wanting to do integrative care a little bit differently. So we are really focused on good diagnostics. So not just, finding the root cause and saying, oh, your anxiety is from hormone imbalance, but saying, all right, why are your hormones abnormal? Is it metabolism of, is it gut? Is it, is it because you are in a moldy environment? Is it heavy metals? Like what's the true root cause here? And being really inquisitive and doing really good intakes as well as thorough lab analysis, and then using integrative medicine as our treatment plans. So supplements, using medication smartly if we need to, supplements, diet, sleep, sleep, stress modification, like anything you can think of that's in the integrative realm, we utilize in our office as our treatment strategies.
Awesome. So will you tell us before we really start, what is the difference? Like, what does integrative mean and what you're gonna get different than like your like Western medicine primary care physician person?
Yeah, some similarities you might see between us is that we do use similar language. So, we are trying to look for diagnoses like Hashimoto's thyroiditis. Like we will be, if your thyroid is abnormal, the labs indicate your thyroid's abnormal, we'll go and additionally try to find what maybe the root of that is and give you a diagnosis if that's appropriate. So you'll see some similarities in like trying to obtain a diagnosis, using blood work, drawing labs. We use objective data in that way. So that's probably a similarity. And then the difference is that you will see us having like 30, 60-minute and 90-minute visits to really sit down, talk to you, get to know you. You might say like, oh, I have anxiety, and they might take you for face value at that. But what we're going to do is say, oh, you have anxiety. What does that feel like? Is that mental rumination, or is that palpitations, sweating? And, there's going to be differences in where you go for the root cause, depending on how it's manifesting. And so you're going to have to, you're going to feel a little bit like, oh my gosh, this is so invasive. All the questions that we ask you, does it get worse around your cycle? Does it trigger with food? If you're super constipated, like, does that trigger your anxiety after a few days because your bowel movements are not moving through you, the biggest nerve component of it? Like, we're just going to ask you so much more in-depth questions about something like anxiety, where that might be the end of the conversation if you're in a traditional Western medicine. So, and then with us, you're going to get, obviously the different treatment strategies. We might recommend a med, but that's where we always have a plan to, if it's your choice to go on it, we're going to tell you good informed consent, all the pros, all the cons, what you could do differently, and then also have a strategy to get you off of it. And say like, this is safe and effective right this minute. And we think that if you can make these changes in the next 4 months, we can start to taper you off of it and get you off of it. So,
Love
um,
that.
yeah, we're just kind of using like the best of both worlds.
Which is so good because not either is good or bad, and they all have their
Correct.
use
Yeah.
too. Awesome.
Yeah.
Okay, so in terms of I'm going to speak in terms of postpartum today and ask questions along those lines. So what are you seeing in people, women postpartum most often?
Postpartum, we get a lot of the postpartum anxiety, postpartum depression, and like an umbrella term for like postpartum depletion. So a lot of iron deficiency, a lot of nutrient deficiency, and then all of the nervous system dysregulation that goes along with like stress and not sleeping. And so you're looking at like insomnia, anxiety, depression. And we get a lot of postpartum, we'll see a lot of postpartum hair loss, although I will say there's not a ton we can do about it, but that's a common concern.
Sure. Well, and yeah, that being said, like, how do you, that postpartum period is so weird because you are not sleeping and maybe not nourishing your body very well and recovery and yada yada. How do you know when to like go get help or like versus like let's wait this out a little bit, maybe when the baby's sleeping better or when's it a problem?
For postpartum anxiety and depression, where it's becoming all consuming of your mental health, like you're starting to get nervous for health of baby, health of partner, and you're just feeling really overwhelmed and worried about your own health and safety, immediately we will see you immediately. We will help out. There are many things that create those neurological imbalances, both hormones, neurotransmitters. But when it comes to something like um, you know, I'm trying to get my body back from having a baby, we ask you to wait. We would tell you to wait. We would tell you that you can't really do much with a microbiome other than take a probiotic, because a lot of the herbals that kill off bad yeast, that kill off parasites, that kill off dysbiotic bacteria, you can't take when you're breastfeeding. And so we'd like you to be further postpartum, 6 months, 6+ months, before we start digging into some of those concerns.
Sure, that makes sense. Um, Will you tell me about autoimmunity postpartum? I feel like I see a lot of patients. I have some autoimmunity. I don't always tell patients like, hey, you should go check for autoimmunity. But like I feel like so many people get stuck in that rut postpartum trying to lose the weight and things like that. And it's like, oh, actually you have an autoimmune condition. Why does that happen? What are the shifts that make that so prevalent?
Yeah, so it's the large hormonal swings that there's the current theory for why that is. When you're normal cycling, you don't ever go from 0 estrogen to 500 estrogen. Like you stay in that, you know, 75 to 150, you stay within a closer, tighter knit numbers for your hormones, which then does not necessarily get these negative feedback loops to the brain that you should alter your immune system or alter how you are reacting to your stimuli out in the universe, like scents or mold or pollen or danders, or obviously bugs like strep and things like that. You're having those big hormonal swings of like 500 during pregnancy down to like 0 within 5 days postpartum. And
Oh
then
my,
if you're breastfeeding, basically staying at 0 until several months postpartum, that huge swing essentially sends feedback loops to alter your immune system. And we know that the biggest times for women to get an autoimmune condition would be puberty, when you've got those swings, each pregnancy, not just your first one, and menopause, perimenopausal state, because you're getting those huge fluctuations. And so it's something that we knew perimenopause and menopause, things like rheumatoid arthritis and there those autoimmunities that happen later in life. And I think a lot of people assume that they were because those people are old, but it's not. They figured it's the hormonal swings, especially since they mostly happen in women than in men. But in postpartum, even things like ulcerative colitis and Crohn's, celiac disease, Hashimoto's thyroiditis, there are several autoimmunities that you can get just from those huge swings. Partial, I'm sure some of it is genetics, right? If you've got the genetics for it, and then you've got these huge swings, it can turn on or turn off those genes, and you can express something a little bit different. But we believe it's because of those hormonal fluctuations. And I wish that I could say like I have the magic cure for it not happening, but I think I don't. I we There's not a lot of safe herbals and things that you can take to help taper that large plummet of hormones. Because we also think that it's necessary to create more breast milk as well. Like we believe that it's helpful in helping prolactin be more stimulated and start to increase. Um, and so we kind of just have to let things ride and just support your immune system as we can.
interesting. Huh, I had not heard that theory, which now makes me think think of different patients, and I'm like, oh, really interesting.
Yeah, and it's each pregnancy too. That's like the kicker, is that people will get tested for these things after their first pregnancy, like Hashimoto's in particular, and they don't have it. Their antibodies are negative, and then they don't get tested after subsequent pregnancies. And then I get them when they're in their mid late 40s, and they've had this now for almost a decade. And at a decade past, you've got some glandular destruction of your thyroid gland, and um, you can't always correct what I don't really think that you can correct scar tissue of the thyroid. You can just preserve what you have left, but
Sure. Yeah. Yeah, the damage is done. Interesting. Okay, so give us like three good tips for that postpartum period to support our bodies from your perspective, right? And especially being a mom too, when like we probably can't sleep very well and whatever, how can we support ourselves in potentially other ways?
I think one of them is going to be like, I'm going to say nutrition, but I don't mean it in like the traditional sense of, I want to just say like nutritive density. So, there's a lot of herbal teas that are very nutritive, and just getting back those small minerals, those, bigger nutrients like iron, magnesium, zinc, obviously continuing to take your prenatal, if not more, because you just lost a ton by delivering that baby, and you're losing a ton by creating milk. And so, even doubling down on things like supplements, if you're able to, teas, obviously really good food, but we know that you'd have to eat like a pound of broccoli to get enough, DIM and I3C and other nutrients that are in there to really make a big impact. So that'd probably be one of my big ones, is like double down on the nutrients that you're intaking. Two would be some form of adrenal support. And whether that is like just you yourself trying to do some circadian rhythm retraining, with a light box, like a vitamin D, 10,000 lumen light box, in the morning time, some PMEF mat, or just some grounding outside, really trying to just, if you can, keep your nervous system a little more balanced. And with that can come adaptogens. There are safe adaptogens for breastfeeding. There's not a lot of safe adaptogens for pregnancy, but once you deliver, there are more options. One of my favorite is holy basil. So I love holy basil tea, or even capsules. And that can be really, really helpful at just kind of like helping your cortisol, helping your adrenals kind of re-regulate. Obviously, there's nothing we can really do about circumstances and stress and whatnot, but I always like to really just try to get women, especially while they are pregnant, to start focusing on adrenals, and then what does that plan look like, and what's your postpartum going to look like, and schedule that ahead of time. Oh man.
I agree. That was a lot. I mean, those two were pretty
Yeah, I
loaded.
was like, that's probably my biggest two.
Yeah.
I think my third, there's so many people in this postpartum space that you have no idea even exist. And there are so many good people, craniosacral therapists, lactation consultants, who, by the way, all practice almost remarkably different from each other. And if you don't like the one that you went to, find a new one. Um, you know, pelvic health, like there's so many people in this postpartum space that you don't even know. And just being curious about, I need this kind of help, asking around who can help me, and then like seeking help when you need it, even if it costs money. Things like HSAs can be really helpful, and just kind of creating your team, because it is way too overwhelming to make your own plan, to diagnose yourself, make your own plan, and figure out how you're gonna keep doing the plan, and like just let someone help you with that, because even I'm the worst patient. I know all the things, and I still make my own plan, and I still don't follow it. But when someone else makes the plan for me, I'm golden.
I am like, I will pay you to make me a plan because I know what to do. I'm just not doing it. And so please just help me. And I will follow your instructions because I want to be good.
Yes,
I want you to
exactly.
like me. Yes.
Yep.
Cool. All right. Well, thank you so much for your time.
Yeah.
You guys are on social,
Yep.
right?
We love social. It's kind of our digital business card. We love to give you insider looks into what we're doing here, some of the things that we're talking about, educational topics. We do free webinars once a month about rotating topics. So always kind of check back in of what our, we always post them on our Instagram, what our webinar of the month is. So, we really try to give, like, if you wanted and you did not have the resources to find someone and ask for help, we want you to have the resource to try to do it on your own. It can be hard, but fully understanding that this type of care is not always accessible, and we're doing what we can to make that different.
Love it. Cool. Well, thanks for your time.
Yeah, you're welcome.